Hello, Colorado. Thanks for joining us today. This is really a critical moment in the pandemic. It has never been more dangerous for the unvaccinated than it is right now. 1 in every 48 Coloradans are infected and contagious with COVID-19. If you're fully vaccinated, the risk is 10 times less or even greater than having a major health problem. But for those who are unvaccinated, it's very dangerous. There's an easy way you can solve that, and that is to get vaccinated. It's free, it's quick, it's easy, and it's a simple thing you can do to protect yourself and protect your community. For those who have been fully vaccinated, I would encourage every Coloradan to get their booster shot, as I did. 6 months after you get the Pfizer Moderna shot, you're due for a booster, you should get it. 2 months after Johnson & Johnson, you should get it. Or, if it's been 6 months, 8 months after you got Johnson & Johnson, go in and get it. And any one of them will do. The data shows they all will supply significant increased resistance to you. The situation we're in really shows the difference between the Delta variant and previous strains. The Delta variant is highly effective at seeking out the unvaccinated, infecting them, and in many cases hospitalizing and in some cases killing them. It's an extra reason to get vaccinated if you've been putting it off. The danger level is very high if you're unvaccinated, and you can address that. You have a choice to protect yourself, and I really encourage you to do it. I'm joined today by State Epidemiologist Dr. Herlihy and Jill Lester, who's a patient who received monoclonal antibody therapy. We're going to be talking about the importance of monoclonal antibody therapy. What I want people to know is that this is for after you get a positive result on a test, but before you're so sick you're in a hospital, right? So you have COVID, you have symptoms, your test comes back, you're like, oh my God, I have COVID. If you are at higher risk of hospitalization, meaning you're in your 60s, 70s, if you have a pre-existing condition that puts you at risk, even in your 50s, get monoclonal treatment. It can reduce hospitalizations by about 70%. It'll reduce the likelihood that you will be hospitalized by about 70%. It's too late once you're so sick you're in the hospital. You want to get it in those first few days after you get the positive test result. You are sick. This can prevent it and will prevent it from deteriorating where possible. And to be clear, that can reduce your chance of hospitalization by 70%. That's not nearly as high as the vaccine, which reduces your chance of hospitalization over 90%, right? So get vaccinated. This is not a backup plan, but if you get COVID and you're at risk, you should get monoclonal antibody treatment. And we are working on scaling that up across the state, but we also want to make sure directly that more Coloradans know about it and seek it out. Because that also means getting tested early, right? If you're ill and if you have symptoms, go get tested. Don't put it off, because there may be a treatment that significantly improves your chances of surviving and of not being hospitalized. An update of where we are today. We still are in a very dire situation with regard to cases in hospitals. The high level of spread continues across our region. 1,476 Coloradans are currently hospitalized. That's an increase from 10 yesterday. There's a decrease of 4 pediatric hospitalizations. Only 19% of the 1,476 people hospitalized are vaccinated. So, what that means when you have less than 300 vaccinated people in the hospital, almost about 1,200 people that are unvaccinated, we wouldn't even be here talking about this if everybody was vaccinated. There would just not be a crisis at all. It would be not fun. A couple hundred people in the hospital, never fun, but it would be the normal course of business for hospitals. We wouldn't be in this dire situation where, because there's 1,200 unvaccinated people that come from that 20% of the population that's not vaccinated, only less than 300 people that are vaccinated. So it's 279 vaccinated people in the hospital, 1,197 unvaccinated. And I would add, even if you have to be hospitalized, your chance of making it out is also better if you're vaccinated. So it reduces your every step of the way. It protects you. The vaccine reduces your chance of getting it significantly. If you're not vaccinated, you're going to get COVID. Maybe this week, maybe next month, maybe next year. And one lucky person out there won't get it, but you're probably going to get it. You want to be vaccinated when you get it. It'll not only decrease your chance of getting it, and you probably won't get it. It's a lower chance you get it. But when you do get it, much lower chance of hospitalization and much lower chance of death. Breaks my heart that we have 5 12 to 17-year-olds hospitalized right now. All of them unvaccinated. It's unnecessary. That number can be 0. Get your 12 to 17-year-olds vaccinated and get your 5 to 11-year-olds vaccinated. There's 25 kids under 11 in the hospital. That number also can be 0 within a couple months. If every parent does what we did, what our friends did, gets our kids vaccinated. Our kids were glad to get vaccinated last weekend. Earlier this week, we announced the statewide actions we're taking to move forward and weather this crisis in Colorado and blunt the impact of the virus on our hospitals to make sure that they're there for us as needed. Those steps included expanding hospital capacity. We all hope it's not needed, but we want to be ready to meet what the projections say. And that's why we plan to have 500 new beds in the next 30 days. That's not a standalone center. It's generally reactivation of different sites. We've already increased by 20 beds at Parkview and Pueblo. Working to make indoor events safer through vaccine requirements. You've seen what Kroenke Sports has done in Ball Arena. We're working with cities to roll that out for additional places where a lot of people congregate indoors. Expanding boosters. We issued an executive order that basically said that since Colorado, like many states, is a high-risk area, everybody can get the booster. Everybody should get the booster. Please, if you got the vaccine 6 months or more ago, get your booster. It's a really important part of protecting yourself. It's a really important part of ending the pandemic in Colorado. Additional regulatory relief to enhance healthcare workforce in force. Many pieces in there already. We need every qualified, able-bodied person to help on the front lines right now. Thank you to our healthcare workers. Overworked, difficult circumstances, often people yelling at them. Thank you for being our frontline heroes, and we hope that more people can step up and be part of that emergency workforce. And what we're going to talk about today, which is extremely important, and that's expanding the use of monoclonal treatment. The data around monoclonal treatment is clear. I want to turn it over to Dr. Herlihy to speak about how this treatment can prevent you from being hospitalized due to COVID-19 and also help relieve our hospital system from unnecessary hospitalizations. Dr. Herlihy.
Thank you, Governor. Good afternoon, and thank you for being here today. As the Governor mentioned, Colorado continues to see an increase in COVID-19 hospitalizations, and our healthcare system is feeling significant strain. This figure shows the number of people hospitalized in Colorado over time, including our fall peak last year at 1,847 hospitalizations on December 1st, and today's value of 1,476, the highest number we've seen since mid-December. One of the really unfortunate trends that we've seen in the last week is a rapid increase in hospitalizations. That's shown by the increasing steepness of the line on the far right end of this figure. Following this rapid increase, we updated our modeling projections and found that Colorado could see hospitalizations as high as our current maximum hospital capacity in the state. I shared these findings earlier this week with the Governor's Expert Emergency Epidemic Response Committee, or the GERC. And at that meeting, I shared data on 2 ways that we could potentially decrease hospital demand in the state. The first, as the Governor discussed, is to increase uptake of booster doses in the state. That's a significant way that we can decrease the number of individuals that could be hospitalized here in Colorado. And second is the increased use of monoclonal antibody therapy. Next slide, please. So today I want to share more information about monoclonal antibody therapy with all of you. The figure on the left here shows you additional work that our modeling team has done. This figure shows you the range of possibilities of hospitalization numbers when our team ran hundreds of simulations of our model for 2 different scenarios. In the first scenario, our current uptake rate of monoclonal antibodies, so the current rate we're seeing now, is carried forward. And the range of hospitalizations for that scenario is shown in light blue. In the second scenario, we assume that 50% of people who are eligible for monoclonal therapy receive them. So we see a significant increase in the number of people receiving monoclonal antibody therapy. And that range of hospitalizations is shown in green. So based on this work, if we are able to substantially increase monoclonal therapy use in Colorado, we estimate that we could decrease peak hospitalizations here in Colorado by 150 to 300 at the peak. We could reduce Colorado's current risk of exceeding hospital capacity by nearly 30%, and we could prevent 2,600 hospitalizations and 210 deaths between now and the end of February. Thank you.
So thank you, Dr. Herlihy. You know, ever since the FDA authorized monoclonal antibody treatment, it's been shown to decrease hospitalization risk by about 70%. It's one of the most effective drugs early in the course of infection to treat COVID-19. It's especially important for older Coloradans and those who are immunocompromised and at higher risk. And that's why awareness is so important. That's why we wanted to talk about it today. Many Coloradans don't even know this is an option. We're working to expand this across more providers. We're working to break down barriers to the treatment. In the coming days, we're implementing a standing order that allows Coloradans to qualify to seek out treatment without a referral or orders from a doctor. If you test positive and you have symptoms, you can get it. We have mobile stations that are able to provide monoclonal treatment, and we've challenged our top providers in our state to really increase the number of doses given. They, of course, will also benefit by the reduced hospitalizations in the weeks that follow. If you've been diagnosed with COVID-19, you could be a candidate for monoclonal treatment if, of course, you have to be an adult, have tested positive. You already have mild to moderate symptoms. If you're asymptomatic, you're not a candidate for it. You experience your very first symptom within 10 days, and you're at a higher risk, meaning everybody in their 60s, 70s, and 80s who gets a diagnosis of COVID and has symptoms should get this. And then people younger than that, if you are obese or moderate to severe asthma or having immunosuppression or cancer treatment, you would be an excellent candidate for that because you are at a very heightened risk of developing very severe symptoms that require hospitalization. And I would encourage you to get that. You can, if you meet this criteria, you can visit our website to find out where to self-refer. We'll have that updated in the next few days as to where you can go directly to get it. We already have several buses out doing it. You can find the latest location of our mobile buses or connect with the virtual center at UC Health, which can also confirm your eligibility. 161 enrolled monoclonal providers across the state. We expect that to increase in the coming days, including the 5 mobile buses, and that is the website that you can go to. Follow that link to find out where you can get monoclonal treatment near you and confirm your eligibility. I also encourage you again to go to the virtual health center at UC Health, which is also working to step up monoclonal antibody treatment, as is Kaiser, as are other systems. We launched the 5 mobile treatment centers. We're going to add 5 more monoclonal antibody treatment buses by mid-December. Those will be in both urban and rural areas, very accessible to people. People will not need to go to a doctor first. They will need to show that they have it. Precautions will be taken if you have mild to moderate symptoms already. Again, if you are experiencing immediate distress because of COVID and having trouble breathing and low oxygen, you need to go to the hospital, right? This is for pre-hospitalization in those early few days of COVID-19 when you're sick. But you don't go get monoclonal instead of going to the hospital. I want to be clear. If you are having significant trouble breathing, low oxygen levels, you're in immediate distress, go to the hospital. But when you get the COVID-19 test back and you're positive and you have fever and you're sick and you have flu-like symptoms, go get the monoclonal treatment, right? So it's not instead of going to the hospital, it's before you would need to go to the hospital. It's one thing to hear the statistics about monoclonal treatment to say, wow, it can reduce your risk of hospitalization by 70%. But it's something even more compelling to hear from someone who's experienced those benefits firsthand. I'm excited to introduce Jill Lester, a monoclonal antibody treatment patient who's willing to share her story with us. Jill and her husband both contracted COVID-19, and they both received monoclonal antibody treatment, which dramatically improved their recovery. And Jill's willing to share her story with us here today. Jill?
Hi, my name is Jill Lester, and I'm here because I was the lucky recipient of monoclonal antibody treatment, or MAB. My husband and I completed our COVID vaccinations in mid-March, and I was eagerly looking forward to traveling to Europe in early August after the lifting of travel restrictions. My son-in-law is a major in the U.S. Army, stationed in Germany with my daughter and my 2 young grandchildren. I hadn't seen them in 17 months, and I really missed them. In early July, my husband and I contracted COVID after a mini vacation in Glenwood Springs. Unfortunately, we went there before they knew how easily the Delta variant could be transmitted. By the time we got back from the trip, he wasn't feeling well, and within 2 days he felt very badly. He was flat on his back in bed, which was very, very unusual for him. Cough, chills, headache, body aches, and fever. He felt sick enough that he was worried he would have to go to the hospital. Our family physician wasn't familiar with how to get monoclonal antibody treatment. But fortunately for both of us, I had been advised by a UC Health emergency room doctor with whom I work occasionally that if we or any of our peers contracted COVID, to contact UC Health about MAB, or monoclonal antibody treatment. We were eligible due to our age. Through UC Health, we were able to schedule my husband for monoclonal antibody treatment the very next day. Thanks to MAB, my husband felt significantly better within hours of the treatment and fully recovered his health several weeks later. Then I got really sick about 5 days after my husband. I was also in bed with terrible body pain, headaches, fever, and cough. It took me a few more days to actually get a positive COVID test, and by then I was desperate because I needed to get well to go to Germany. I too received monoclonal antibody treatment. The infusion went very smoothly, and while it took me a couple of days to begin feeling better, I then quickly and fully recovered. We're both so grateful to UC Health, to Dr. Reno, to Dr. Mitchell, and the MAB team, and on our own behalf, and also for friends and others who we told about MAB and who were also able to receive monoclonal antibody treatment at the UC Health clinics. The staff was wonderful. The treatment was efficient and uneventful for us. We were able to recover faster and reduced our risk of complications. I got to go to Germany and see my grandchildren. Thank you, Governor Polis and the CDPHE, for getting the word out. I'm so glad that we have this wonderful monoclonal antibody treatment technology to help us recover better from this frightening illness. Thank you.
Jill, thank you for sharing your family's story. And it really shouldn't take just having to hear about it word of mouth from somebody who works in a hospital. That's why we're doing this public awareness effort to say directly to people that yes, if you get diagnosed with COVID-19, you have mild to moderate symptoms, and you are in your 60s, 70s, or 80s, or 90s, or you're younger but have another factor that puts you at significant risk, this can decrease your risk of hospitalization by 70%, which is great for you, but also great because we need every bed that we have in our hospitals for people who are sick, whether it's with COVID-19, with a heart attack, with a stroke, with sepsis, with any other condition that we routinely serve in our hospital system. It's always powerful to hear these compelling stories, and I hope that this makes a difference for those of you who are listening. And of course, the biggest difference you can make is get vaccinated if you haven't been yet, and get boosted, get that third shot if you have got the first two 6 months ago or more in the case of Pfizer, Moderna, 2 months or so in the case of Johnson & Johnson. We're also excited by our effort to get more Coloradans 5 to 11 years old vaccinated. We're well on our way with 22,419 children, including my 2 children. About 5% of 5 to 11-year-olds already got at least 1 dose, and that is lagged a day or two. It's probably even more than that because we have 48-hour reporting. Get boosted with the increased prevalence of virus in our state. You need that extra protection. We need that extra protection. Many shots are 3 courses. DTaP for kids is 3 courses. There's not enough data nor enough time where nobody knows whether this one is 3 courses and it works for years or decades, or whether you need more boosters. But we do know that you need that third dose right now, and we know that it works at reducing your risk of getting it, hospitalization, and of death. And of course, now is an important time to wear your mask indoors around others in crowded settings. A mask can also help lower your risk of getting infected and prevent you from spreading the virus. If we can do these things, if we can get vaccinated, and I know we can, if we can get boosted, and I know we can, if we can wear masks indoors around others, and I know we can, then we can end this pandemic. Thank you, and I'm happy to take questions.
You mentioned working with cities to keep people safe indoors. When could we see the rollout for that? And is there a chance that we could see events and capacity for crowds going back?
So there are already venues that have implemented vaccine passports, like Ball Arena, I think, just implemented in the last couple of days. I don't have anything to announce right now, other than that yesterday, or was it the day before, we announced that we're working with cities for more of the larger venues to implement these models, and we expect more news in the days ahead, in the next couple of days, really, on that. I would expect that some of those additional when you know that everybody else is either vaccinated or tested, you can have a lot more confidence going out and going to a venue. And so, especially with the high levels of the virus we have, we want people to have that confidence, and we also want to avoid these large super spreader events, because the Delta variant is so effective, like a laser-guided missile. It's seeking out the unvaccinated, infecting them, hospitalizing them, and in some cases even killing them. What was your second question, by the way? Oh, so at this point, again, we think it's, as long as everybody's vaccinated or tested, there's no environment in the world that's perfectly safe, but it is a much higher level of safety in that indoor environment than if there are a lot of folks that are unvaccinated or haven't been tested that are part of that environment that can rapidly spread the virus.
Did you have another question? Well, just asking about crowd capacity limits.
Yeah, what I was saying is it's the more important factor is whether people are vaccinated or tested. It's a difference. There can be risk in whatever you do, and there are some Coloradans who are avoiding going out. But if you're fully vaccinated, if you have your booster, the risk is more than 10 times less for you than it was last December during our height when really nobody was vaccinated at this point. If you have not been vaccinated, the risk is significantly higher for you than it was last December.
Mr. Governor, Dylan Thomas with Channel 4. Quick question for you. You mentioned those additional 500 beds.
Yeah.
Hospitals are already seeing staffing shortages and stress. How do you plan on staffing those 500 additional beds?
So some of that is the augmented FEMA team. So that is actually the 20 additional beds or so at Parkview and Pueblo is staffed by FEMA. I think there's 2 other FEMA teams on the way. The others include temporary staffing, both through providers as well as the state looking at temporary staffing contracts and how we can focus more people, because it is about space and about people. It's about both. But of course, the plan to expand to 500 additional beds includes staffing for those beds as well over the next 30 days. I would just to also clarify, not all 500 are going to be acute care beds. It'll be about half and half, meaning half will be acute care hospital beds. The other half will be something analogous to what we also did before and didn't wind up utilizing very much during the last phase, which are what we call step-down beds, where folks that don't really need to be in a hospital but they can't be home yet can also be stepped down, freeing up the full hospital bed for somebody else. So it's a combination of both for those 500 beds.
Governor Jason Grenauer here from Denver 7. You've been pushing the message, get vaccinated, for months now. You said something today to the extent of, if you're not vaccinated, you're going to get COVID. Without any other major state action, though, isn't that in some way saying if unvaccinated people are not going to get a shot, we just have to wait and deal with this rise in case numbers and hospitalizations?
Well, what our goal here is to spread it out a bit. If you're not vaccinated, you're very likely to get COVID. 90% plus chance you're going to get it. We don't want everybody to get it at once. If everybody gets it at once, we're in a lot of trouble because we can't serve everybody with COVID or heart attacks or strokes. The best thing you can do if you're not vaccinated yet, get vaccinated. Then you can quite likely avoid getting COVID. And if you do, you're a lot less likely to have a negative health outcome or need hospitalization or, God forbid, die. But the truth of the matter is that this will be an endemic condition. People sometimes ask, is the pandemic over? Absolutely not, with 1,400 people hospitalized in Colorado, almost 1,500. But when the pandemic ends, the disease doesn't go away. It'll be here in a year, it'll be here in 5 years, it'll be here in 10 years. They're at different points in time. In the years ahead, there could be 100 people in the hospital, there could be 200 people in the hospital. But that will be endemic. That'll be a kind of normal level of hospitalization with other conditions relative to our hospital capacity. The reason we're having these discussions and these urgent discussions now is where we are at now is simply not sustainable, right? And we are very close to, which is why we are adding 500 beds, our hospital capacity, and we want to make sure we can serve everybody that gets sick. So that's why we have this ambitious plan now in terms of monoclonal, in terms of making indoor spaces with others safer, in terms of continuing to expand hospital capacity. We want to make sure that we meet that need.
Yeah, one two-part question for you real quick. Can you also talk about who's staffing the monoclonal buses that you guys are sending out?
Yeah.
And then the second part to that is, has the state found a reason as to why we're seeing this spike when many other states aren't seeing the spike?
Yeah, well, the spike is a regional spike, so it's kind of Minnesota and west coming down through us and New Mexico. The states seem to have different policies, different approaches, but what that would indicate is the fact that they all have a spike, and I think we're 7th now or 6th, is that it's probably something to do with weather and behavior and our region of when people are indoors. But really, scientists simply don't know exactly why our region has a spike. There's some silver lining. Our spike is not as bad and not likely to be as bad as the Southeast spike of 2 months ago because we have a higher vaccination rate. It would be just as bad here if we didn't. Thankfully, we do. But that doesn't, it still means that a lot of people are getting sick. So it's in different waves at different times geographically. We're better positioned because of our higher vaccination rate, but there's still a lot of unvaccinated folks here. And I just want to convey in so many ways, if you are unvaccinated, you've been hesitant for whatever reason, just take a fresh look at that risk assessment, right? Like there's some reason you haven't been vaccinated yet. If it's a fear of needles, just get over it and do it. If you get COVID, they're sticking a lot of needles in you in the hospital. IV, it'll be in you for days, right? So whatever that reason is, just suck it up and get protected because this thing isn't going to go away.
Monoclonal, if you wouldn't mind touching.
Yeah, that's a contractor. I can get you the name of the contractor. So we contracted for staffing. Do you know it offhand, Maria? Okay. Yeah, so those are contract services in the 4 buses going to 8 that provide that. Just as the vaccination buses are also contractors.
Hi, Governor Dave Perry with Sentinel, Colorado. Do health officials there believe that statewide or targeted mask mandates or proof of vaccine and really any size of public place would significantly reduce COVID infections and the stress on hospitals? And if they do, why won't you invoke them?
Well, Dave, we announced that we are moving towards working to have more indoor event spaces like Ball Arena that have either vaccination or testing requirements. So please watch in the next day or two for the announcement on that. Masks, there's no question that on the individual level, a mask can delay when you get COVID, right? It's not going to prevent you from getting COVID. And when you do get COVID, if you're unvaccinated, it's going to be just as bad. But at any given time and in any particular interaction, if you're wearing a mask, if both people are wearing masks, it can reduce the risk of you getting it in that interaction with somebody who's contagious with COVID, which is why we're encouraging mask wearing indoors around others with COVID levels this high, especially if you're unvaccinated. But it's a good practice for an additional layer of protection if you're fully vaccinated as well. In terms of where areas that are requiring them or not requiring them, it's a little harder to see through the static on what the impact of that is. I'll give you an example, Dave. Our neighboring state of New Mexico has had a mask wearing requirement really for the last couple months statewide and seems to be at about the same place we are with regard to infection rates. I think they were a little higher than us yesterday, but they basically tracked with us over the last week or two. There's states that do and states that don't. So it's easy to say wearing a mask will protect you because absolutely it delays your chance of getting COVID at any given point in time. It's a little harder to figure out what a mask order does in different areas and what impact that might have. One hypothesis is that those who are unvaccinated are the least likely to follow a mask order. And obviously, if we're trying to get them to do one thing, it would be to get vaccinated. That's more important for them and their health and for society than wearing a mask. Why? Because if they wear a mask, they're probably still going to get COVID someday, right? It may get it in 4 weeks instead of 2 weeks and 8 weeks, because every interaction reduces it by about half, and there's some value in spreading it. But when they do get COVID, it'll be just as deadly as if they weren't wearing a mask. Whereas if they get vaccinated, of course, they have a very, very high level of protection, and if they do get COVID, much lower rate of hospitalization and death. So they're all important. The area that I live has an indoor mask requirement. There's areas of our state that do. We're in regular contact with county public health officials to evaluate whether that's the best policy for them. And of course, we're always looking at anything that can give us an additional edge in Colorado in helping to weather this storm and the pandemic.
Can I follow up with just one more question?
Yeah, go ahead.
About monoclonal antibodies?
Yes.
Is it recommended for people who have been vaccinated that become ill with COVID, even though that they've had the vaccination?
Yes, you can still be at risk if you are vaccinated. If you are, 86 and vaccinated and contract COVID, you could very well still be a very good candidate for it, as well as if you're immunocompromised and vaccinated and contract COVID. So by no means is it only for unvaccinated individuals. You can absolutely still be at risk, even though it's a lower risk at any given age level and health level. There are still people who are fully vaccinated who would be considered at risk. So don't rule it out just because Jill, you were vaccinated. Jill was vaccinated, was still at risk and received the monoclonal, and it worked. Of course, if you're unvaccinated, please get vaccinated, right? Again, the monoclonal is not as effective as the vaccine. Want to be clear about that, right? Monoclonal might reduce your hospitalization risk by 70%, but you already got it. A vaccine reduces your risk of getting it by over 90%, but also being hospitalized by even more than that. I have a statistic here from UC Health about their intubated that I want to find for you about who's vaccinated, unvaccinated. It's even more stark than the fact that 81% of our hospitalizations are unvaccinated. I'll find that for you in a moment. So, but the short answer, Dave, is that yes, you can still be considered at risk if you are vaccinated. I don't know if I have it here, but maybe my staff can correct me if I'm incorrect. But I believe that UC Health reported that is it 91% of the intubated patients are unvaccinated. I'll give you that number in just a moment. But Dave, it's numbers like that really augment the fact we say that 19% of the hospitalizations are vaccinated, but those generally are less severe cases. And so I kind of want to emphasize that even those who are hospitalized and vaccinated are there less likely to intubated, kind of all of those things that more granular. Is it 91%? So 90% of UC Health's intubated patients, intubation is the last treatment, right? And you're either going to make it or you don't. And I mean, it's earlier in the pandemic, the odds were close to 50-50 at that stage. They're a bit better than that, but it's tough, right? I mean, you're intubated. You don't know if you're ever going to wake up, and your family doesn't know if you're ever going to wake up. And 9 out of 10 intubated patients at UC Health are unvaccinated right now. So that's even more stark than the fact that 19% of all the hospital patients are fully vaccinated, but only 10% of those who are intubated. So that provides that additional protection.
Governor Polis, Sarah Flower with KSUT, Four Corners Public Radio. I'm hearing, we are very close to New Mexico down here, and I'm hearing you on the mask mandate, and they've actually just extended theirs past their November 17th deadline, saying that if they didn't have one, how much worse it would be. And asking people to get vaccinated right now, you're not fully inoculated until 5 weeks after the fact. Why not put a mask mandate in front of this laser bullet, I think that you just laser missile, as you just called it, to protect people right now, to do something immediately?
Well, again, there are areas of our state that have mask requirements, but rather than focus on the mask requirement policy, I think that the focus is how can more people wear masks. I mean, it's a good idea to wear a mask around others in crowded indoor areas. If you're not vaccinated, that can delay when you get COVID. But, unless you get vaccinated, it still has that very high risk of hospitalization and death. It does not reduce severity. We hope that masks show evidence of mask requirements work. If they were working in New Mexico, we would certainly not hesitate to implement them here. But we just haven't seen the data that supports that.
Oh, quick question for Dr. Herlihy. So throughout this week, we've had around 300 breakthrough cases just throughout the week. Is there any idea why we're seeing so many right now, and what do we know about those patients? Are they older? Do they have underlying health conditions? What's their status there?
Yeah, so we do continue to track vaccine effectiveness here in Colorado, and we haven't seen a substantial change in vaccine effectiveness in the last few weeks in the state. So we do expect the proportion of individuals that are breakthrough cases to go up over time, and that's simply because there's a growing population of vaccinated people. So that proportion is going to continue to increase as time goes on. But what we're looking at instead to really track whether the vaccine is working at the same level is that vaccine effectiveness. We do expect with some level of waning immunity, though, that we are going to potentially see as people get further and further out that they're less and less protected. And of course, that's why booster doses are important right now. And you've heard the big push from CDPHE and our Chief Medical Officer, Dr. Eric France, to really encourage adults over the age of 18 to receive booster doses at this time to really try and limit the impact of waning immunity in our community.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Governor, in Spanish, hemos recibido mensajes de nuestra comunidad donde nos indican que no hay suficientes vacunas de refuerzo o booster y deben esperar hasta 2 semanas. Considerando que los hispanos están entre los más afectados por la pandemia, ¿cuál es su estrategia para garantizar suficientes vacunas para la comunidad?
Actualmente tenemos suficientes vacunas cada día para todos que lo quieren. Puede ser que el lugar a donde han ido esté lleno, pero la recomendamos que busquen en otro lugar, tal vez. Por ejemplo, en nuestros autobuses, visiten covid19.colorado.gov para encontrar los lugares. Hay muchos lugares, farmacias, clínicas, autobuses, donde pueden recibirlos.
Hello, this is Meg Wingeter from the Denver Post. I have 2 questions about boosters. One, I just wanted to make sure with what you had answered there, if you were saying that if people can't get a vaccine, their normal is not giving boosters to everybody, or are you just suggesting they try some other places until they can find one?
Yeah, every site that administers it is supposed to give it to anybody who got it 6 months ago, 2 months ago. But I'm sure somewhere there's an employee or a person that doesn't know that, and of course we want to know about that so we can make sure we inform the partner. But yes, there's so many different places that you can get your booster: pharmacies, clinics, the mobile vaccination stations. County health departments are standing up vaccination events. There's one at the Aurora Municipal Building today. So there's lots of different ways to get it. Some are walk-in, some are appointments. But you can go to covid19.colorado.gov and click on vaccines to find a provider near you to get that booster scheduled. Second question, did you have a follow-up?
Yes, I did. And with recommending that get one, including people who are still very protected from severe illness, is the concern that at some point immunity is going to wane to the point that those people are not as well? Yeah. Or is it more of a concern of if they get a mild infection and then happen to be with somebody who's unvaccinated and give it to them?
So it's all of the above. There's additional protection at the individual level, regardless of your age group. Now it's smaller if you're younger, but who wouldn't want that additional protection? Because there's less degradation in the protection if you're younger. But of course you want it. That was the Israeli study with over 1.1 million people in that study and reporting out. So individual protection increases for every age group from the booster. It's more enduring. And then secondly, the spread of the virus across society is decreased by the more people get boosters, because the more that you can reduce the likelihood of a healthy 40-year-old getting it, that also means that it's less likely that they will then spread it to their parents or their grandparents. So the benefits are at the individual level, well documented, really for all age groups. Most important for everybody in their 50s, 60s, 70s plus to get it immediately. But really a good step to take if you're in your 20s, 30s, or 40s too. Just get that booster, get it over with, and you'll benefit from longer lasting protection and stronger protection.
Governor Chris Vanderveen with 9 News. You've been asked a lot over the last week about masks. I'm not going to ask you about that. But what I do want to ask you is this. With Colorado heading toward potentially its worst wave yet, is there anything that you think you could have done differently over the last 6 to 8 weeks that would better prepare us for where we are now, knowing that there were plenty of people that were worried about this very precise scenario?
Chris, anything that we could have done to get that vaccination rate higher than it is would have made a difference. We did well. We always wish that we did better. We had 5% more vaccinated, 8% more vaccinated. There's a chart that we'll send you, where we correlate the county vaccination rates with the county hospitalization rates. What it shows very clearly, first of all, is that there is a direct correlation. Counties with low vaccination rates have high hospitalization rates. Counties with high vaccination rates have low hospitalization rates, of course. But what you also see is that when you get to around 80% fully vaccinated in a county, and we have counties there, Boulder County and Pitkin County and a number of others, Denver's getting close, you see that they have about 1/3 to 1/4 of the hospitalizations from COVID that the counties with the lower hospitalization rates like Pueblo, Weld, and others have. It's a very profound way to look at this. We did a lot to get where we are. Our wave will not be as bad as the Southeast states because we have a higher vaccination rate. But if we had successfully found a way to get it even higher, we wouldn't be experiencing what we're experiencing today. I feel that I put my back into it and all that I can do to get people vaccinated. We've been visiting vaccination clinics, publicizing it, making it available. We implemented a best practice for the state workforce where you have to be either vaccinated or be tested weekly. Many private sector employers have done so as well. But Chris, that's the single biggest thing. If Colorado had been at 90% instead of 80% 6 or 8 weeks ago, we simply wouldn't have be facing anything like what we're facing today. And by the way, it's 80, to be clear, Chris, it's 80% of adults. It's only about 63.4% of the total population that's fully vaccinated. I think it's 80% of 18 and up have had their first dose. So, I mean, whichever figure you draw from there, we're in that 65 to 80% range for vaccination here. But obviously, adults driving the hospitalizations. We watch the pediatric beds closely, but they have not been of great concern as the adult beds have been. Sorry, go ahead.
Hi, Governor. Seth of the Gazette. Sorry for my delay there. 2 questions for you. One, following up on Chris's question. So beyond, wanting to get the vaccination rates up, which to a degree sounds like that's something that's going to be on the unvaccinated, is there anything the state could have done differently, particularly since cases started moving up in July, that could have addressed this peak before we are approaching when we're about to approach, it looks like.
Well, yeah,
And-
I think we're grateful that our peak was now instead of 2 or 3 months ago, because we do have a higher vaccination rate than we did then. We don't expect that this peak will be as severe in terms of ratio of hospitalizations to population as it was in states that peaked when they had a 40 or 50% vaccination rate. I can only imagine what those states were going through because we're having a tough time at 70 to 80% vaccination. Now our counties that are at 80% plus fully vaccinated again have 1/3 to 1/4 the hospitalizations of the counties that are in the 50s and 60s. So it makes a big difference where each county in Colorado is at, and we'll get you that chart as well. But what we are seeing is that states across our region, from Minnesota to Wyoming to New Mexico to Colorado to Utah, our region, our sort of slice of the United States, is now all showing increases and has elevated incidence of the virus, as does Colorado. These states are doing different things at different times. I think the strongest correlation there is that the higher the vaccination rate, the less severe the spike is, and the less the hospitalizations are.
Hi, Governor. Katie Eastman with 9 News. Despite hearing the percentages of protection, there are still people who trust COVID-19 treatments like monoclonal antibodies, but don't trust vaccines. What's your message to them?
Well, look, it's apparently too late, and you didn't trust the vaccine. I'm sorry you didn't. You wouldn't have had COVID, probably, or you wouldn't be in the dire health situation. But now that your life's literally on the line, trust modern medical science. Take the monoclonal treatment. It'll decrease your chance of hospitalization by 70%. We all make mistakes. You made a mistake by not getting vaccinated. We're not going to hold that against you. We want to give you the very best treatment you can have to get better. And if you have mild to moderate symptoms and you're elderly or at risk, monoclonal treatment early in the infection is the best chance you have at making it through this.
Governor Daniela Leon with Fox 21 News here in Colorado Springs. You said Coloradans over the age of 18 are eligible for the booster shot. However, some of us are experiencing difficulties obtaining the shot, specifically at Walgreens locations, whether it's in person or online. Is your office or the state health department aware of any challenges providers may be facing in administering the shots, or why this may be occurring?
We'll elevate your specific concern about Walgreens. Was this in the El Paso County area, Walgreens, did you say?
Correct.
Yeah. So we'll elevate that with that provider. I'll talk to them this afternoon. But no, in general, it's gone smoothly. And we certainly hear from people who just went in, walked in, made an appointment, got their booster, no issue. We do hear about incidences where they haven't yet gotten or absorbed the executive order and Dr. Francis' requirement that they're open for everybody. And we'll make sure that specifically we pass that along to the El Paso County Walgreens. I've heard folks from other Walgreens in different parts of the state who've had no issue. Look, there's going to be and I have sympathy for the people working there. I mean, there's a manager and there's somebody who's, working hard there and probably overworked and tired. And we want to make sure that they give the booster to everybody. And I don't doubt that there's a few instances where they're still wrongly turning people down. And we hope to correct all of that in the next few days. Thank you all for joining us.